And welcome back, folks, to another installment in the Healthcare Business Network. That's hbnradioshow.com, hbnradioshow.com. I'm Ron Nyman, and here to welcome you back for another episode in our shows on the business of healthcare. And this week, we're going to be discussing the topic of electronic medical records. I know many of you might be expecting a discussion on meaningful use, but we wanted to take a turn on that and diverge from that this week. Instead of talking about meaningful use and electronic medical records, we wanted to talk about compliance and how the whole issue of compliance interfaces with electronic medical records. And to help me in moving this discussion along is a distinguished guest. His name is Dr. Reid Gelzer. And Dr. Gelzer has over 30 years of service in the healthcare area, which includes 11 years in primary care practice. And he also served for 3 years as an EHR vendor. Dr. Gelzer has his primary interests now in EMR system trustworthiness, data quality, and information integrity. And Dr. Gelzer co-founded the Advocates for Documentation Integrity and Compliance, and he recently published the manual called How to Evaluate Electronic Health Record Systems. Dr. Gelzer is also a senior physician informaticist for Vangent Buccaneer and is on staff at Provider Resources, which supports CMS's meaningful use process and the Medicaid Managed Care Quality Review protocols. He also is a consultant, and he has clients that include the Defense Centers of Excellence, the U.S. Navy Healthcare Data Quality Office, and United Healthcare's Special Investigation Unit. That's their SIU unit. In addition, he's also consulted with the Office of the Inspector General, that's the OIG, at the Department of Health and Human Services. Dr. Gelzer has also chaired a fraud management project work group for the Office of the National Coordinator, and he also volunteers extensively with such groups as HL7's EHR Records Management Evidentiary Support Profile Working Group and the American Health Information Management Association, that's AHIMA, as well as serving for the past 3 years on the CCHIT group in the areas of ambulatory, privacy, and compliance expert panel and work groups. Dr. Gelzer lectures, speaks across the United States on the whole concept of compliance in EMR systems. So without further ado, let us welcome to the HBN Radio Show, Dr. Reid Gelzer. Dr. Gelzer, welcome.
Well, thank you very much for that rather embarrassing introduction.
Well, it is all true, and it is, like I said before, a great honor to have you on our show. I want to get right down to it and just start out with an overview, just a brief overview, Dr. Gelzer, a brief history and overview of electronic medical records.
Sure, happy to do so. In a nutshell, as soon as people started working with computers in academic environments and also in military environments, the applicability of information management to healthcare became immediately apparent. After all, as we all know, healthcare is very much about information management. And some of the earliest efforts to develop what we would recognize today as clinical documentation systems occurred in academic centers. And interestingly enough, that probably helps explain why some of the anomalies have occurred in how these systems have evolved. Namely, because in most cases, the systems evolved in academic settings with clinicians focusing on clinical documentation. The concept that these systems also had to operate as formal business records with all the integrity and compliance supports was actually a rather late addition to some of those discussions.
So let's ask you the first question here on the whole issue of compliance in EMR. When did you begin to focus on this issue of are EMR systems compliant?
It's interesting to trace the evolution of one's interests, of course. I had the benefit of learning about the medical legal requirements for clinical records actually when I was in medical school. And so in the course of my medical training, I was also doing standards of care research for Detroit area law firms. And because of that, I became very familiar with the concept of a record as both a legal document as well as a clinical decision-making and information support document. Now, spin forward a number of years, I'm in practice in rural southern Michigan. I have about 6,000 active charts, and they're all paper, and I'm realizing I really don't have much of any way of knowing what's going on in that population because it's all just sitting there in paper files. And like so many of my peers, thoughts about wouldn't applying computerization to this be a wonderful thing. Spin forward a few more years, I went to work for an electronic medical records vendor in Connecticut, and in the first demonstration of how their system worked, they showed me some rather interesting functions, which, to make a long story short, were things that nobody would ever do in a paper record, things like deleting entries or changing the date on entries or copying a medical record from one patient and pasting it into another patient's record because, after all 45-year-old men are the same, so their physicals should be identical and things of that sort. And finding that that was built into a number of systems, I went to a trade show with my partner in ADIC, Patricia Treitz, who's a well-known compliance authority. She and I put together a small testing protocol, and we went to a electronic medical records trade show and tested about 28 systems, and in all cases we found really rather astounding anomalies in how they handled records, and the types of anomalies that would quickly put one afoul of basic compliance principles for both business records and clinical records.
If we could just stop there, Dr. Gelzer. When we come back, we have a commercial coming up, but when we come back, I'd like to go over those anomalies or those compliance risks that you did find and a lot of people today are not thinking about during their when they're going through the process of purchasing an EMR. We'll be back in 1 minute after we have a moment's break here and a commercial from our friends at MediStar.
Are you looking for a billing company that can increase your revenue, effectively manage your credentialing, deliver the right software, and provide guidance in navigating the minefield of compliance? MediStar has been providing the right answers for hospitals and physicians for over 13 years. We go the extra mile by paying attention to the details and focusing on aggressive follow-up. Recognized for 4 straight years by Inc. magazine, our professionals can help you attain your revenue cycle goals while helping to ensure that your work is done in a compliant manner. Call one of our experts toll-free at 888-423-8080. That's 888-423-8080. Or visit us at www.medistarbilling.com.